Hi, everyone, and welcome to this afternoon's presentation. Franciscan Health and our community health improvement partners present the mental health webinar for new moms. Thank you for making your health a priority by spending an hour with us today. I'm your host, Robbie Schneider, our social media manager at Franciscan Health. I'm excited for our team to share some great information with you about perinatal mental health today. This afternoon, with the help of some of our experts, we're going to help you better understand perinatal mood and anxiety disorders and answer your questions in a live Q&A. Before we get started, though, I want to share a few housekeeping items with you. For this virtual event, participants are muted. We ask that you remain muted to help us avoid background noise and interruptions during the program. And if you have any questions to ask the presenter during our presentation, please type them in the chat window, and we'll answer your questions at the end of the webinar today. Our administrator, Kirsten, is taking care of everything on the back end for us. And if you experience any technical issues at all, just type them in the chat window and we'll work to resolve them as quickly as possible. And if you miss anything, there's no need to worry. We're going to send out the recording of today's presentation to you in a follow-up email. Franciscan Health works with our community health partners to help improve women's and maternal health here in the state of Indiana. And today I'm excited to introduce to you one of them who will be leading today's program. Ashley Hopkins is a licensed clinical social worker, and she works as director of Hendricks in Greater Indianapolis and Hamilton Center. Ashlyn attended Indiana University and obtained her bachelor's degree in journalism and African American and African diaspora studies. She furthered her education and completed her master's degree in social work from Indiana University. Ashlyn has been in social work for 12 years, working with individuals of various ages who struggle with anxiety, depression, perinatal mental health disorders, PTSD, trauma, and other mental health conditions. Ashlyn is a certified perinatal mental health specialist working with families as they navigate through the perinatal period. Ashlyn is a member of the National Coalition of 100 Black Women Indianapolis chapter, a member of the Indiana Black Breastfeeding Coalition, and a member of the Family Care Council with Juvenile Court. She's owner of Dark Consulting Services and Social Services. Ashlyn is a mother of 3 and works each day to make sure that mental health is included in the holistic view of everyone she comes in contact with. Now, without further ado, please welcome licensed clinical social worker Ashlyn Hopkins, who will share information that can help mothers, pregnant women, and those planning for pregnancy, fathers, and those who work with pregnant women and mothers. Thanks, Ashlyn.
Okay, good afternoon. Can everyone hear me okay? I seem to be having some difficulties. Okay, everyone can hear me? Okay. All right, there we go. Sorry about that. Well, good afternoon, everyone. Thank you so much, Robbie, for that introduction. Just wanted to take a minute to thank everyone for being here. Thank you, St. Franciscan, for allowing me to be able to share information with you. Thank you to my coalition sister, Juanita Fitzgerald. Again, my name is Ashlyn Hopkins, and I will just be sharing some information with you today, talking about perinatal mental health, kind of just an awareness, what to look for and how you can help. So on our agenda today, again, talking about what perinatal mental health is, perinatal mood and anxiety disorders, which we like to call PMADs. So what does perinatal mental health, who does it affect? When does it occur? We'll also be talking about suicide. September is Suicide Prevention Month, so we will tie that in as well. We'll also talk about what the risk factors are there any disparities, and again, how you can be of service. So I just wanted to take just a few seconds here to think about something. How often is there an intervention in a soon-to-be mother's life before she delivers a baby? I think a lot of times we tend to forget about mom when we get to the point of delivery. When that baby comes, it's all about the baby, right? Oh, here she is so cute. She has 10 little fingers and 10 little toes. And then we forget about mom. So perinatal mental health is all about remembering, mom as that vessel, and just along that whole period, mom's overall health, including her mental health, and how we have to be able to intervene if necessary, be able to surround mom and provide support as mom goes through a transition after delivery. So just want to look at a few stats here. We have 1 in 7 mothers have postpartum depression. 1 in 5 mothers will suffer a PMAD. So again, PMAD is perinatal mood and anxiety disorders. And then we have 1 in 10 dads, and yes, I said dads, will suffer postpartum depression as well. So now we're going to take a look at what is perinatal mental health. And how I like to do my presentations is I like this to be a little interactive. So I know everyone cannot come off of mute, but if you could just use the chat and kind of put in there, what is perinatal mental health to you? What is your definition? How do you view it? We can just take a few seconds to do that. So what we have is perinatal mental health. It is the psychiatric disorders that present during pregnancy and throughout postpartum. So PMADs, again, perinatal mood and anxiety disorders. So mood disorders are comprised of depression, bipolar disorder, and psychosis. And then we have anxiety, which are the obsessive compulsive. We like to say postpartum, traumatic stress disorder, and then generalized anxiety disorder. Okay, I guess the chat is disabled. So sorry about that. Okay, so I wanted to do something a little different in terms of getting everyone to understand the difference in talking about perinatal mental health. So I'm going to use my infomercial voice here to kind of paint a picture when we talk about perinatal mood and anxiety disorders. And I wanted to use that with baby blues, because we hear baby blues a lot. And sometimes you may even hear that, hey, baby blues is could be a PMAD. And I want to emphasize that baby blues is different. And baby blues is something to where 4 out of 5 moms will experience. And when you think about that, 4 out of 5, that's 80%. So even if you take a mom that may have had 5 pregnancies, right? We can almost say that 4 out of 5 of those, she will experience baby blues. So what are baby blues? Are you crying out of the blue and don't know why? Did you just give birth and have a feeling as if you don't know who you are right now? Everything seems to irritate you and you've been snappy. You may even feel down, sad, and not able to get comfortable to sleep. Can you sleep, or are you constantly looking over at your newborn and wondering if they're breathing? This just gives a look at what a mom may be thinking during this time. The baby blues usually occurs within a few hours to a couple weeks after delivery. Mom may be tearful. You may walk in and mom is happy, and then you turn around and she's not, and she doesn't even know what's going on. The important thing to highlight with baby blues is that those feelings go away. They do not stay. So that is the difference between the baby blues and a PMAD. So, has it been over a month and you just can't find a reason to smile? Do you want to be alone and not socialize with any of your supports? Have you found yourself reaching for hours to sleep, but it's never enough to feel rested, or it's too much to even bear holding your infant? Do you find yourself thinking over and over again about possibly suffocating your baby while you breastfeed? Or do you have thoughts you don't want to say out loud because they scare you? Do you blame yourself for what happened? Are you wondering, why do you not feel like a mother? Do you believe that your baby is broken? This gives a snapshot of what a perinatal mood and anxiety disorder looks like. Anything, and we can say there may be a couple of mood and anxiety disorders just in this alone, but if you're hearing anything like this coming from a mom, this is something to let you know that there's something else outside of baby blues that is going on. So, breaking down the perinatal mood and anxiety disorders, we have depression. So depression, the mood disorder, comprised of an array of feelings such as sadness, anger, we can say disrupted thought process, problems with memory, concentration, withdrawal, someone that may want to isolate themselves. This will be the postpartum depression. And then we have anxiety, right? And anxiety is that constant, intense feeling of worry or fear that affects your everyday life. So what that may look like is the overthinking of the mom, the worrying. Oh my gosh, my baby is so quiet. Why is my baby so quiet? I don't feel comfortable unless I hear my baby crying. Okay, I need to go in there and make sure that my baby is still breathing. Or worries about being a new mom. I don't know how I'm going to do this. I'm just so scared. I've never been a parent before. The baby is so small. What if I can't give the baby what they need? Things of that nature. We like to say that is anxiety. Now, we also have obsessive compulsive disorder within a PMAD as well. So that is a disorder comprised of obsessive thoughts and or behaviors. And so that could look like thoughts of perhaps scared that your baby may drown or that your baby might suffocate. In the infomercial that I did just a slide before, where if you are a breastfeeding mom, but then you have this thought of, oh my gosh, what if I hurt my baby while I'm trying to feed my baby? 3 to 5 moms will experience OCD within their perinatal period. And then we'll talk about intrusive thoughts later. But those intrusive thoughts are a big flag that lets you know, okay, maybe there's some OCD going on. So again, here goes some additional stats. 6% of pregnant mothers have perinatal anxiety. 10% of mothers in postpartum will have perinatal anxiety, and up to 5% of mothers will have perinatal obsessive compulsive disorders. Now, although these percentages may look low, we also have to think about the possibility of the moms that we may not know about. There's a lot of different things that we have to factor in, which we'll get to later. But I truly believe that these numbers would be higher if we screened more moms. So additional mood and anxiety disorders, we have bipolar. So that's the depressive disorder comprised of the high and lows of the moods, and then the manic episodes. So when they're down, they're really down, and when they're up, those are the manic, the hypermanic episodes. Then we have psychosis. So psychosis is a rare and serious mental illness that is comprised of delusions, hallucinations, and manic episodes as well. And psychosis presents itself after childbirth. We'll talk about psychosis here in just a few slides, going in depth with that. And then we have the postpartum PTSD. So it's a condition where someone struggles to function from the effects of a traumatic and terrifying event. And here we have 9% of moms that have been diagnosed with that. So some of you might be asking yourself, well, how could giving birth be a traumatic event? Well, let's see if the baby heart rate is too high or too low, if mom has gestational diabetes, if mom has preeclampsia, say the umbilical cord is wrapped around the baby's neck, or hey, mom could have found out while in utero the baby has a certain type of medical condition. All of these things play a part in the actual birthing experience. Whether or not the medical team had to use forceps or a vacuum to be able to retrieve the infant. And it really doesn't matter if it's vaginal birth or cesarean as well. A mom could think that overall process, having to get the epidural, thinking about all that your body has to go through when you have a cesarean procedure. That's a lot. Your body goes through a lot of stress. That's a traumatic experience for your body alone. So any mom that has those type of experiences can have effects as a result of that. So now, when we talk about suicide, I wanted to bring up intrusive thoughts to be able to just have a discussion. Must be on my end. Okay. Have a discussion on the difference between the intrusive thoughts and suicidal ideation. So intrusive thoughts are those unwanted, involuntary, random, uncomfortable thoughts and images. And these are things to where you may not even know where that came from, but you're having those thoughts. A lot of mom experiences intrusive thoughts, but they don't want to talk about it. If you think about going into your post appointment after delivering, or just your perinatal appointments, and having to tell your doctor, I'm having thoughts of suffocating my baby. I'm having thoughts of drowning my baby, and I don't know where that's coming from. It could be a lot, no one wants to admit that in fear of how that information may be received and what is thought of you. But a lot of intrusive thoughts are triggered by stress and anxiety. So again, intrusive thoughts being a key component to the OCD in the perinatal period. We have to make sure that we do a good job of distinguishing what intrusive thoughts are as opposed to suicidal ideation, which are the thoughts and ideas of harming self and taking one's own life. Because there is a difference. So I put here having to ask this question, are you having thoughts of suicide? Now, if anyone has been a part of any QPR training or suicide assist training, you will know that these trainings now are emphasizing to be able to ask these questions and ask this question specifically. Because when you think about going into your doctor's office, usually the first couple of questions they ask you are, do you feel safe at home? Are you having thoughts of harming yourself or anyone else? You know, you might not get the answer that you're looking for by asking that second question, as opposed to saying, are you having or have you had any thoughts of suicide? That lets everyone know it's all put out there on the table. I'm asking a specific question if you've had these thoughts of actually taking your own life. And studies have shown that when you ask that question directly, you are able to provide an intervention. And this will also be something that would distinguish between suicidal ideation and an intrusive thought. Mom may be like, oh no, you know, I had no thoughts of taking my own life. It's just thoughts that I may harm my baby in this way. And then you will know from there which way to go. So again, as we look at suicide, we also have to include psychosis. So psychosis is when someone loses their sense of reality. Okay, they don't know what is real or not real. So whatever narrative they are in at that point in time, that's their narrative. And no one can tell them otherwise. Now, it can happen in a few weeks to a few months after delivery. Have there been instances where psychosis can come even more months after delivery? Absolutely. That is rare, but it can happen. So we have 1 to 2 in 1,000 will develop psychosis. 5% of those individuals commit suicide. 4.5 commit infanticide. And we're looking at about 6,000 moms a year. Again, this is information that is reported, right? What we know of. There has to be an even bigger number of what we don't know. And the thing about psychosis, a mom could be in psychosis and say she may take a break. Someone may come over and help her care for that infant. And she may not act on anything. Her reality may not be to cause harm. However, her having that altered reality is a state of emergency. Okay. Anytime that a mom is in psychosis, it is an emergency. There is a client of a colleague, and she gave me the okay to share this story of someone that she was working with that is actually serving time because she went into psychosis after delivery. Baby was about a month or so old, and she thought something was wrong with her baby. In her mind, she felt like her baby was broken. Not broken from what, but just broken. And she wanted to fix her baby. So she shook her baby. Luckily, in this situation, the baby did survive. And when mom snapped out of psychosis, because she did not have anyone around, she was the one that ended up contacting authorities and informing them of what happened, that she felt like she did something, because at this time, the results of showing, the harm on her baby, and come to find out that she was in psychosis. So we want to make sure that if you suspect anything in conversation, and if something doesn't sound quite right, that this could be something that is going on with mom. I would also like to highlight that if there is no prior history of mental health in mom's medical history, no previous diagnosis, moms that end up having psychosis tend to have later on that diagnosis of bipolar disorder. So moms that do have a pre-existing diagnosis of bipolar, whether it's bipolar 1, bipolar 2, we want to kind of, put a little flag up in terms of making sure that once mom delivers, that she gets the care that she needs, whether that is getting back on any medication, therapy. That way we can try to avoid mom going into psychosis. So we looking at the symptoms of PMADs, and I just kind of grouped them all together, and not all of them are listed here. Hopefully everyone has a handout from Postpartum Support International with symptoms, and I know there's another handout as well that will be forwarded to you all. So we have lack of interest in things or lack of interest in your baby. Mom may have thought that, oh yes, I'm just gonna be all in. I just want to hug and she may not even want to pick her baby up, and really not know why. Low motivation, so really not wanting to get up and do anything, feeling guilt or shame. Sometimes this happens, especially if there's any PTSD that's involved with the delivery, or any type of anxiety about just what the future will look like in parenting. We have anger and irritability. Again, the intrusive thoughts, sadness, worry, appetite changes. So whether mom doesn't want to eat at all or if she's overeating. Hallucinations and delusions, paranoia, mood swings, low energy, problems with concentration, disruptive thought process, feelings of hopelessness, worthlessness, panic attacks. And panic attacks is something too to highlight there, because there's also the panic disorder that can fall into a PMAD as well. And so when you look at the physical symptoms of that, of course we have sweaty palms, racing heartbeats, things of that nature that can send mom into a panic attack. So when can a PMAD occur, right? We're talking all about what is a PMAD, but when can it happen? Oh, looks like my computer's a little delayed. Uh-oh. Okay, I'm gonna ask if, okay, Kirsten, are you able to take back control? Because I don't know what's going on my end and it's slowing some things up. I would greatly appreciate it. Thank you. So when can a PMAD occur? So PMADs perinatal refers to the time of conception all the way up until the child's first birthday. So a PMAD can occur any time during that time period. Now, I want us to also think about this in terms of if there is not a pregnancy that ends in a live birth, okay? So whether that is because of a miscarriage or an abortion, we want to make sure that if there was a pregnancy, there was conception, right? Because we got to look at that body changes. Then a PMAD can still occur up until a year of when that due date, after that due date would have been for that particular perinatal episode, what I like to call it, okay? So that is something very important to remember, because sometimes moms can get lost in the shuffle if that perinatal episode did not end at a complete live birth, and you might not know, unless you ask a question. So that is something definitely to highlight. So it can occur in any time during that time frame. So we're looking at about 21 months. 21 months. Next slide, please. So who is affected by PMADs? Next slide. Any female or male within a perinatal episode can be affected by a PMAD. Now, here in recent years, a lot of studies have shown the effects of perinatal mood and anxiety disorders on the males in the home, and that is because of mom. And we'll talk a little about that here in a minute as well. So, and again, it can happen at any age, any culture, and then anyone that has any of these risk factors that we'll also talk about here in just a few. Next slide, please. So again, with the male and female, there's this thing of mirroring. And a lot of times it can happen if anyone has a mental health condition within a household, and say they are around someone a lot, whether their spouse or significant other, or any type of supports that may be around that individual majority of the day. Dads tend to get postpartum if mom has postpartum. And so when we look at perinatal mental health, we can look at it as a unit. If there is a unit within that home, we are able to step in and help provide support for that unit, because both are experiencing those symptoms. So risk factors. Your mental health history is a risk factor. So if a mom has a previous diagnosis of a mental health condition, we can also highlight any family history in regards to mental health as well, can be a risk factor. Pregnancy and delivery complications. So again, this plays a part into the postpartum PTSD. So anything related to that. It was interesting to know that in my training for my PMHC, the different things that categorizes a traumatic pregnancy. For instance, hyperemesis, and that is where mom is constantly throwing up all the time. You may have some moms that may vomit their whole pregnancy for whatever reason. I was one of those moms, and that occurred in all 3 of my pregnancies. So to think about, like, wow, is that a traumatic birth? Well, we have to stop and think about that. It can alter the way that you do things in your daily life. So when you're at work, when you're at home, if you're out with friends, certain things that you eat, or not being able to eat anything at all. Once it goes in, it comes out. There's also the spitting. You have some mothers that they have that, and it's just where those glands just over reproduce the saliva, and they're constantly spitting all of the time. That is something too that affects the birthing experience. And that adds stress. So those are risk factors. Lack of support. So whether or not that mom has anyone at home or at work, outside community, we also have to look at any faith-based organizations, religion that may play a part, any type of support. If there is none, because that can play on the mom's mood going forward. Um, Issues with breastfeeding, we see these a lot. I've seen these a lot in moms that I've worked with that have made the decision to breastfeed and may have some difficulties. Okay, got a note saying I was frozen. Can everyone see me? Oh, can we go back, please? Sorry. Okay. Just wanted to make sure everyone can see me okay. So yes, so issues with breastfeeding, surrounding that mom with support, it can be frustrating if the mom is having issues, if the baby is not gaining any weight, or it could be a painful experience for mom because she doesn't have any support to help teach her the appropriate ways to breastfeed. First time pregnancy is a risk factor. If you're not getting enough sleep, issues at home, at work, so we have to take that personal life into consideration. NICU admittance. Anytime a mom gives birth and is looking forward to holding her baby, whether it's through vaginal delivery or if it's through cesarean, and you want them to bring that baby over to you and press that baby's face against yours, or you be able to have an opportunity to skin-to-skin contact, if that does not happen because something is going on, their studies have shown that that causes a lot of stress and that creates a traumatic experience for mom and baby. So having the baby go to the NICU, whether it's for a few hours to a few months, that is a risk factor for a PMAD. Any pregnancy losses, history of infertility, we have thyroid disease, and in the event you have multiple children under the age of 5, are all risk factors. Next slide, please. So I wanted to just touch on some disparities too, because we can't forget those. And I would say that the disparities should also be included in the risk factors. So women of ethnic and racial minorities are less likely to be screened for postpartum depression. And we have to ask ourselves why. Now, there could be many reasons why in regards to the cultural differences, the definition of vulnerability and what that may mean in terms of, an individual feeling as though they could do it themselves. They don't want to feel weak. If religion comes into play, a lot of individuals lead to religion to be able to help them through those difficult times. We still need to screen our ethnic and racial minority moms. Black women are less likely to receive treatment for mental health. That's something else that we have to include. And we have to look at those maternal mortality rates as well. And I know they different by the state, but that all factors in why we're not seeing certain numbers. So again, like I highlighted before, these numbers may be higher, but when we factor in certain disparities, we get the numbers that we have right now. So that's why we need all that we can out there, paying attention. If it's a mom, a friend, a coworker, a patient, to be able to look for the signs, to provide information and support, and to be able to help them to get the services that they need. Next slide, please. So just some other stats. So we have more than 6,000 women will suffer from a maternal mental health disorder in the US every year. Like I said earlier, what I like to call a perinatal episode when we're looking at when can a PMAD occur. Again, when we're looking at a mom who's had multiple pregnancies, we cannot assume that every pregnancy will end up like the one she had before. We can assume, though, that, hey, if mom's been pregnant 3 times, 4 times, 5 times, 6 times, one or more of those times, she may experience a perinatal mood or anxiety disorder. So we have less than 15% of women receive treatment. And a lot of this could be the stigma of mental health. So there are some things that layer up that can make it difficult, but now that more information is out there, I know with the perinatal mental health certification, which started in 2018, we have more individuals being trained in different areas to be able to reach all the moms and the families. That way we can have a huge impact. Up to 50% of women living in poverty will suffer from a maternal mental health disorder. Robbie had sent an email of an article, which I put in my references. And the article was talking about pregnancy Medicaid. And so when we look at the state of Indiana, any mom that is on pregnancy Medicaid, before you would have health coverage up until delivery, and then your coverage would end. Well, now to kind of help with the maternal mortality rates, and then when we look at perinatal mental health, they have signed it into law to extend that out for an additional year past the delivery date. So this is huge. It's a big step forward. Because that will cover mom for any type of medical appointments and mental health appointments. So a lot is getting out there and understanding moms needing that mental health support, right? There's been years of us knowing that, okay, all of the hormones change when you conceive, and then all of the hormones try to go back to normal after you deliver. And people really don't understand. And when I say people, those who have not gone through that, to understand what it all entails when you are pregnant with a child and what the body goes through. So again, that has been extended for an additional year after delivery for those moms to be able to get support. So I found this and I thought it was important to share. So you see here a new mom, and she has her friends or supports around her saying, "Congratulations on your new baby. Life is now complete. Look what you have." And she's saying thank you. You know, how sweet of you to say, because that is, you know, from the outside, right? She's like, okay, but on the inside, this is what she's feeling. Look at all I have. What about what I've lost? I've lost all connection to my former self, my career, my body, time with friends, alone time with my husband, and a sense of who I am, spontaneity, intimacy, and financial security. I have no privacy, no confidence, no freedom to come and go. I have no idea what I am doing, no time to do anything I'm used to. I'm trying to be grateful, but I miss me and the life I had before. I thought this was a perfect snapshot in terms of going back to that first picture that I shared with you all about when is there an intervention for the mom? after a baby is born? And a lot of people can't answer that question. And we have to make sure that we do not forget about the mom in the process, that we do not forget about the family unit. Because going back to the mirroring, and we have mom and dad, just taking a quick question poll here. Can a perinatal mood or anxiety disorder affect anyone else in that home? Absolutely, kids included. So whether mom has postpartum depression, dad has postpartum depression, if mom has OCD, if mom goes into psychosis, that affects everyone that is around mom, everyone that may be in that household. So we have to include that as well. Next slide, please. So how can you be of service? We talked about what perinatal mental health is, and we talked about PMADs, and we talked about when it occurs, who it affects, and we talked about the disparities within that, and we talked about how suicide can play a part with individuals that may have a perinatal and mood disorder. So you may be asking, okay, some of this looks familiar, whether you've experienced it yourself, or you may know someone that is going through that right now. So what can you do to help? Next slide. So I had broke these down into 3 sections. So the first one is intervene. And so when intervening, of course, you want to assess for safety. And I put that first because, say, if you're seeing signs that a mom is in psychosis, because it's an emergency, that mom has to be able to get some medical attention right away. So assessing for safety, making sure that mom and baby is safe, and whoever else that mom is around and in the home, consider as that family unit, assessing the safety with all of those individuals. And then we're looking at, are there symptoms present? And if they are, what are they? What are those symptoms? We have to look at, okay, is this a PMAD or is this baby blues? You know, looking at that time frame, like where are we at within that perinatal period? And then I have the ACE here. So the ACE is the Adverse Childhood Experience Questionnaire. This is a good tool to use, especially if we want to assess for any previous history of trauma. So whether you may have a pregnant mom that comes into the office and you see a few times, this could be something to kind of let you know if there are any risk factors that you should be aware of. I also put the Edinburgh postpartum depression screen, so that's EPDS, and then the zone for anxiety. These are very instrumental as well as far as indicating if there is any postpartum depression, if there's any suicidal ideation and anxiety. The good thing about an EPDS is that you can also give it to dad. It doesn't just have to be for mom. So if you are suspecting something, or if you know and it comes out with mom, by all means, I would also have dad take the screening as well. And the EPDS is something that is usually given at that 6-week post-op appointment. And we need to get in the habit of not just doing it at that time. And EPDS can be used at any time during the perinatal period. So that's something that I wanted to highlight. So what is their birth story? The way that I operate in my practice and in my work has completely changed when I am working with moms, and particularly moms in the postpartum and perinatal period. Because asking that simple question when I am doing an assessment, and if you're not a mental health professional and you're just asking a mom, like, oh, it's just a beautiful bundle of joy, you know, and getting to know her, building some rapport, just asking, what was your birth story? What was it like? And of course, we've heard some, you know, my mom likes to talk about it took her 48 hours to have me, right? But we hear those, but we really don't ask for certain details in the story. Or ask a question behind a comment, right? We have to think about that reflective listening and being able to say, like, oh, your baby went to NICU? Well, what happened? I'm sure that had to be a scary experience. You had an emergency C-section. Well, that had to be scary. And being able to connect that, because the birth story could also tell you a lot. And outside of the birth story, your pregnancy journey, what was it like those 9 months? What was it like those 6 months? Asking those type of questions. No judgment, right? So if a mom is sharing with you that she has had intrusive thoughts, or you're seeing mom just not with it, understanding that mom may be going through something, being able to access any therapeutic service to give to mom. I put the 988 number and 911 to be able to provide. And then, of course, we have the suicide prevention hotline. Next slide, please. Then we have guidance. So guidance, we have education. So being able to educate. So educating mom and then educating ourselves, right? Excuse me. The more that we know, the more of an impact you can have. And the more that mom knows, the more that she's aware. Providing trauma-informed care is something too that would be beneficial. I put down here cultural humility and cultural competency. We hear the two separate a lot, and I'm big on merging those together. So when we think about working with individuals from all different racial and ethnic backgrounds, we have to include that in how we work with them, how we talk with them, and being able to provide them information based off of whatever their cultural background is so they can feel supported. What is available? So we have to look at those community resources to be able to pull for additional support for mom and that family unit. I put down here QPR, so that's question, persuade, response training. When we look at suicide prevention, there's also suicide assist training. So any of those trainings are beneficial as well. And then informing, being able to, provide information to those around you is big too. Next slide, please. So then we have support. And I put here check-in. So you go through intervening and you have all of this information for guidance. There's nothing wrong with the checking in on that particular mom after everything may have been revealed. And just regular check-ins when they come into appointments or when they're talking to you, just how are you feeling? Like, really, how are you feeling? And sometimes it may be something difficult for them to be able to express, but allowing them to be able to express themselves by looking at a feelings wheel or just throwing some words out there, but allowing them to express themselves outside of, oh, you should feel a certain way because you are carrying this to life. No, what is it? Give me the rawness of your feelings and emotions. Being able to identify supports. Sometimes, particularly when anyone has a mental health condition and may be in distress, it may be hard to kind of identify some supports. So if you can help and identify supports, that helps. That way, that mom is aware of what is around her and who she can reach out to. And those supports, of course, can look different. So whether that is family, friend, we have to also think about outside organizations. If connecting that mom to WIC, getting her a public health nurse, programs like Nurse Family Partnership, Healthy Families, Healthy Start, any type of breastfeeding coalitions, things of that nature. All of those categorized as support. Referrals, so getting those referrals out so they can contact mom, networking, listening versus hearing. That is a big thing too, because we have to make sure that we are paying full attention to what's going on and allowing the moms to be able to express themselves so you can capture the full picture to see what's going on. There's also support groups. I put PSI, so there's Postpartum Support International. And their website has a lot of different resources, as well as virtual support groups, and everything listed by state. Also being able to get in contact with the perinatal mental health professional for any type of therapeutic services. Peer support is something else that's really, really good. There's nothing like having someone else that has had a similar experience to be able to say, I've been there. I know what you're going through, and there's a light at the end of the tunnel. Because a lot of times, people may not feel as though they can come out and communicate how they feel if they feel like you're just gonna just lecture. Having an actual peer to understand what they're feeling has been showing a lot of progress. And then of course we have lactation support. So any type of if you have any breastfeeding moms, any type of lactation support is a must, Oh, and I have here, just highlighting the quote, while it takes a village to raise a child, it takes the village support to build up a mom. I really liked that quote. And then the next slide is from a lactation therapist, Jamina Coleman. So everyone wants to hold the baby, but who will hold the mother? This quote is something that has always impacted me greatly, because again, going back to that first picture and just asking like, okay, can we include mom in this snapshot? Can we hold mom the same way that we are holding that baby, with support for her to be able to get through anything that she may be struggling with? So I know that may be a lot of information, but I am hoping that everyone was able to take a lot away from it. I welcome any questions at this time. I do have additional references, so anyone is welcome to contact me and I can provide those in terms of stats and such. But again, my name is Ashlyn, and it was a pleasure. And again, I know we should have some time for some questions.
Ashlyn, thank you so much. And I really love that quote about holding the mother. I think that is just incredible. And I know you mentioned obviously some really important things, like emergency supports and, getting breastfeeding supports if they need it. But what are some other ways that we can help support new and expectant moms?
Well, we can go back to the no judgment. I think that is really big, no judgment, and then no mom shaming. Those two words, mom shaming, has, came out here in recent years. And for anyone who doesn't know what mom shaming is, that's when, you come alongside mom and you say, oh, you're doing that? Well, maybe if you do this,
I think
or
we've all been through that as a new mom.
yes, so allowing that mom to be able to come into her own is something big, and just having support, because mom shaming has been something that also impacts the overall mental health. So that would be another thing that I like.
Okay. What should, if you have a friend or, yourself or someone who is potentially dealing with some mental health concerns before or after the birth, where do they start? Do you start with your PCP or your OB, or what's the best path?
So I say don't wait till that 6-week post-op appointment, especially if you are really feeling like something is going on. So I say reach out right away. So if that's, calling your PCP.
Mhm.
I know I hear from some clients that their OBGYN, they're not really able to get certain supports that they need for the mental health, but reaching out to a counselor too, because some some moms feel as though, okay, I I may need a med, but I don't want to go on a med.
Mhm.
And I didn't highlight that. And I want to stress that there are certain medications that are okay and deemed safe for pregnancy. I think we have to weigh the mom's symptoms, her diagnosis with that as well. And if there's any previous mental health conditions, that if mom is currently going through and is on meds, we have to look at that too, because it may be something that she has to stop or have a new prescription just for the pregnancy period. So we have to look at those things too. So again, contacting the therapist, reaching out to your primary care physician, and hey, if you feel like that you can't do that, reaching out to your supports and let them know, hey, I'm not okay. It's totally okay. I tell my clients all the time, it's okay to not be okay. Just let somebody know that I'm in need of some additional support. And that those would be the first things that I would start off with.
And what if the mom, is kind of struggling with recognizing that, or I don't want to say denial, but maybe they're not ready to talk about it. What can we do then?
So this happens a lot. So I usually tell the supports to um, be as supportive as you can. A big thing um, is sleep helps put a lot of moms back into perspective.
Mhm.
And so giving mom some rest, and if there's a mom that may have the anxiety,
Mhm.
sleep may be, oh, something may happen if I go to sleep, um, but surrounding that mom and in the home too, because we have to look at being able to be there with the mom rather than taking her out of her environment. So if that is where mom feels safe, to be able to provide that support there, and hey, print out some things, a pamphlet, being able to share some, information that way to help mom, to get mom to thinking. On, like I mentioned, on the PSI website, being able to have some support groups. I know on Facebook, there are also perinatal support groups as well, where it's actual just moms venting. And it's very therapeutic for other moms to be able to say, like, oh my gosh, I ran my dishwasher twice too, and to be able to have that support. So just starting there, because we don't want to push, right? We don't want to push. Again, assessing for safety. So you want to make sure that if mom and baby is safe, and it's just mom getting to the point of, okay, I'm not feeling like myself, maybe I should talk to somebody. It's just being there, constantly talking to that mom, and then you're able to provide education through paper form, or like I said, social media.
Okay, that sounds good. Um, are there any other signs that we should be looking for? Because we're also busy these days. It may be where you may see your friend who's a new mom maybe once or twice in the postnatal period. How do you what sort of flags should you be looking for?
If mom doesn't have a connection
Mhm.
to the baby, is a big one. Um, Mom not responding to when baby cries, things of that nature. Those are big red flags that I would look for. Mom seems very distant. Um, and there's no up for mom after delivery. Now, if we factor in if this was a horrible birthing experience, then there may be a reason why. But if mom really does not feel connected to the baby, that is something huge that, okay, something may not be right.
Okay. All right. Sounds good. Well, Ashley, thank you so much for your help and your insights and teaching us all about perinatal mental health and what to look for today. And we want to thank all of you for attending our webinar on mental health for new moms. And definitely thank you, Ashlyn, for sharing with us about perinatal mood and anxiety disorders and what are some of the symptoms, what to look for, and how does it help somebody you love. And we know your time is valuable. So we want to thank everyone for attending today and for prioritizing your health this afternoon by spending some time with us. And we will send the group an email with the recording of our session. And please feel free to watch it again and share it with others who could find it helpful. And you'll also see a brief survey about the webinar and its content, and your feedback helps us and helps us make our future seminars even better. So please take a few minutes to fill that out. And on behalf of everybody here at Franciscan, thank you for being with us and have a wonderful day.
Thank you.